My name is John Parente. I'm the Medical Director of Practice Transformation at CareAllies. As the former Transformation Director at Cigna Medical Group, I led the efforts to bring our 23 clinics to Patient-Centered Medical Home NCQA recognition, as well as CMS 5-star status. Our Practice Transformation program equips physicians with tools to run a higher performing practice. It is a good defense against burnout and provides direct clinical transformation services that drive improvement in key metrics. I'm proud of our initial satisfaction results from our Texas market, where we achieved over a 90% satisfaction rate. We also achieved excellent results in our foundational work around process improvement, workflow efficiencies, and expanding team-based care. We were able to decrease patient wait times, improve medication reconciliation by expanding team roles, significantly decrease phone call volume, improve staff engagement and satisfaction, as well as many others. Now let's hear directly from some of the physicians that are participating in CareAllies' Practice Transformation Program.
It's a large family practice group that's been here in San Benito for about 50 plus years.
We're a family practice group here in Houston in the northwest side.
A large rural practice in San Benito and Harlingen, Texas.
I'm a family practitioner in East Houston and have been going through practice transformation for about 8 months. What practice transformation has done is come in to really teach us how to identify problems in our practice, process improvement and process mapping, and how to really follow up with each individual problem and find solutions as a team.
We took measures like the time it takes to register a patient till we get them out, and how that functioned with each department, from registering the patient to discharging the patient, how the functions of the nurses are, the MAs, the physicians, the lab, the x-rays, how that all ties in together.
Some of the things that we've done through these training sessions have been ways to increase the efficiency of our medical assistants, which for our practice was one of the biggest issues we had. In doing that, what we found is that we were able to speed up the turnaround time for the patients, have the patients wait in much less time, which made them happier, and it decreased the wait time that the physicians had to have to see the patients.
We actually have graphs that were created, which were also very interesting to know, does the patient stay in the room for 5 minutes, 30 minutes, an hour? It was kind of surprising to see those numbers.
One of the changes we made was with respect to our phone calls. We were able to, by analyzing the data and making some changes there, we were able to reduce our phone call volume to the front desk by about 54%, which has resulted in improved job satisfaction with our front desk staff, and has also allowed us to avoid just a knee-jerk response of hiring more employees to handle those phone calls.
What we do as physicians is problem solve individual problems all day, 50, 70, 100 problems all day. So we think we can solve problems real rapidly and quickly, but practice processes are not the same as medical problems, and I think it's really brought to light that these are more complicated problems that when you involve the team, you get much better data, much better input, much better ideas, and then you get buy-in from all of the members of the team, which obviously leads to better solutions.
What this process did for us is it got everyone in the clinic together at a table and sitting down. A lot of us didn't understand some of the frustrations and difficulties that were happening in the other departments, and so this was a really good way for us to sit down, kind of go from the beginning when a patient walked in the door to the time that the patient left, be able to learn the ways to collect that information, interpret that information, break that information down, and then you're able to see where the real problems are and create those ways to make it better.
I think we have seen significant improvement in employee satisfaction, employee buy-in. We're seeing a definite improvement in patient flow, and especially in employee satisfaction, and how problems that they have perceived, we've come together and brought using the practice transformation methods, brought some methods that have really improved all the things that they do day to day.
Overall, we've seen a tremendous improvement in our efficiency. We've seen a lot of improvement in our employees taking more ownership of their duties and feeling more job satisfaction, and we're very pleased with the process in general.
I think it's opened our eyes as far as physicians and the rest of the staff as to how we work as individual groups and how we can work together to make our practice much more efficient and benefit all of our patients.